Welcome everyone for this new podcast on the topic of HIPAA compliance. Today, it's a topic that is not well covered, I think, in the medical device industry, and I think it's becoming more important because there's more and more devices that are collecting or will collect, information that could be confidential information. And we do get a lot of questions from our customers sometime, and we ask them, about their HIPAA compliance. So I think the topic today will be very interesting, and we are very lucky today to have Mike Scheerhorn from the Iron Fort Solution with us. So first of all, welcome, Mike.
Thank you. Yeah, thank you for having me. It's very exciting. Not many people look forward to talking HIPAA, but I'm one of the probably few people on earth who are excited about this sort of thing, and I really appreciate you having me.
Well, obviously, it's not a very sexy topic,
No, and
but
that's
but
good
it
way
is
to put it.
very it's a very important one. I think when we look at new devices that have been clear or approved by the FDA, I think a lot of those product needs probably sort of HIPAA compliance. So before we dig into the topic, can you talk a little bit about yourself, your professional background, and explain what your company does in the medical device space exactly?
Of course. Mike Scheerhorn, as you mentioned, I work for Iron Force Solutions. I am the HIPAA product owner and subject matter expert. And my background is mostly in the data privacy and security space, mostly on the compliance side of the health compliance. So the last probably 10 years or so, I've really honed in my expertise, if you will, on the HIPAA side. And that is something that, I've really enjoyed. And at Iron Fort, we've had the ability to build out a full GRC platform that I describe as 365 days a year, 360 degrees. And so what we do is we take, certain information from your organization, plug it into our platform, and then we are able to generate insights and get you HIPAA compliant probably within a week, right? So, the time it takes us to get all the documentation, we then generate your risks. And the second you start analyzing those risks and starting to remediate them, that to me is a form of HIPAA compliance that, a lot of folks look to get to, and really what OCR is looking for.
Good, perfect. So I know that if I'm not wrong, HIPAA, and it stands for Health Insurance Portability and Accountability Act.
Yep.
So it's kind of a little bit weird, interesting. So that was put in action in '96 by Bill Clinton, actually.
Mhm.
And so, but it says about insurance. So why are we talking about compliance here regarding personal information? What's the link between the two? I'm not sure to understand.
Yeah, it's funny. So many people think the P in HIPAA stands for privacy, and it doesn't. So, as you mentioned, it's the Health Insurance Portability and Accountability Act. And really, what people don't realize is HIPAA was a massive health reform bill. So, for example, the portability aspects in the title is in reference to being able to keep insurance when you lose or change a job, and then the accountability portion is really where the consumer protection part comes in, because HIPAA is the data privacy and security of PHI component of HIPAA is in theory a consumer protection law, and that didn't go. The privacy and breach notification rule didn't go into effect until April 2003. So well after the Clinton administration did those rules really not get enforced, as well as
Okay.
then the security rule in February 2003. So these are very longitudinal, huge health reforms that, kind of gets lost that, hey, isn't HIPAA about my doctor not being able to talk about me? And it's, well, yeah, but it really doesn't say that directly in the rule. It's sort of a byproduct of the requirements for health organizations, which, I think, later on in the convo, we'll get into sort of the confusion and how it gets confusing. But, from a high level, what a lot of people need to be focused on, especially if you're in the medical device space and you operate in that awkward, do we need to be HIPAA compliant, is really the High Tech Act from 2013. And the High Tech Act, essentially, it extended certain components of the HIPAA rule onto business associates. So initially, HIPAA was for covered entities, right? So your hospitals, your insurers, your pediatrician's office, places like that, really anywhere that bills insurance, right? Just to keep it simple. There are many nuances, but if you're billing insurance, you're HIPAA compliant, right? And so if you're a hospital or a pediatrician's office or an insurer, even, you likely have a lot of vendors, right? A lot of people who are coming and going, from your janitorial or environmental staff to, someone, a claims processing company that you use, right? So these are very broad areas, right? And so, even using a janitorial staff, for example, they probably have no idea that they are mentioned, in the HIPAA rule, essentially, where it's, if you have folks coming in to fix your AC or to clean the floors, whatever, you have to note that, right? So there's a lot of different components, but if you are in this industry, you at least should be at a high level, or at least familiarize yourself with the high tech rule. And the reason is that is what eventually will come back to bite you if you don't. So for example, if you want to scale in healthcare, right? You have to work with big payers or big providers, or hopefully both, right? And if not, you can be a DTC company that likely would never have to worry about true HIPAA compliance. But, say Humana comes knocking and says, we want to use your device in our entire population of, 40 to 65-year-old men, right? That your company instantly becomes very valuable, right? And you can now scale. But when they hand you a vendor assessment and they say, do you do train people on HIPAA, right? Or do you transfer PHI or store PHI? And you go, well, I don't think so. I don't know. Well, do you have any policies around if something goes wrong, how you report it to the government or to a consumer? No, we never thought of that, right? And so if you're working with these big payers, what they'll eventually do, right, is if you fail that vendor assessment, which, is very likely if you don't have any of those controls,
Yeah.
um, you then have to go back, implement all that. And if you're, a small company or a startup or, that sort of thing, what are you strapped for? Cash all the time, right? I've never heard a founder say they, are swimming in cash, and, maybe a Sam Altman or someone like that, but there's not many of those guys around. So,
Yeah.
you end up having to go back and implement all these things, pay probably $100,000 plus for a bunch of consultants, lawyers to come in, implement all your policies, put in all these different controls and safeguards and platforms and services, right? And what does Humana do in the interim? They either go and find someone else, or if you're a tech-based company, especially if you're, you're using a lot of AI. I've heard stories of, during the diligence process, an AI company getting their info stolen and the company just building it out themselves, right?
Yeah.
So those are things you have to worry about, in this process. So just having those very basic controls implemented that line to the High Tech Act is probably the number one recommendation I would have because of that. Because at the end of the day, your value, your FMV will go down if you do fail an assessment, because they can't onboard you. They won't do it.
Yeah.
There's
Yeah.
ethics programs that control all these things. And so if you fail that, they don't talk necessarily, but they have the same standards, right? So your valuation goes down, and so then they just either find a competitor or they buy you for pennies on the dollar, right? And they say, well,
Yeah.
instead of giving you the contract, we just bought your technology or your product.
Yeah, yeah. So I think the discussion is interesting, obviously, for our customer, for example, who manufacturing medical device, but also for the vendor here or the distributor who will interact with the manufacturing company, but also with the hospital, because I saw that many often where as a vendor we sign agreement with an hospital, and that's part of the questioning.
Hmm.
do you record personal information? So they do well. Most big, healthcare system, they do take this very seriously, obviously.
Oh yeah.
So is HIPAA strictly a U.S. law, or does it apply beyond the U.S.?
Yeah, that's a very good question, and something that often gets confused. It is a strictly U.S. law. As I mentioned earlier, it's in theory a U.S. consumer protection law. So think of it if you're I think let's say you're a Canadian device manufacturing company, right? Or a Canadian, let's use healthcare provider, right? And you want to treat American patients, or uh, have patients share information with you, that sort of thing, that's when it would apply. I think Canada is a good example because, you do have people, who are, I don't want to say transient, but can go from Buffalo into Canada to get certain
Of course.
services. And if
Yeah.
you want to share that information with one of their, let's say their primary care doctor in Buffalo, and you're a thoracic surgeon in Ontario, you would have to have some level of compliance to exchange that information. And that's where it would fall, where you would sort of fall into the HIPAA landscape. But for the most part, it's strictly US. So if you're in a hospital in London or Canada, Mexico, wherever, not US, HIPAA will not apply. But if they start sharing information with your doctor in the US, it would
I
be up
see.
to your provider and that other provider, foreign provider, to make sure they have the proper controls in place to share that info.
So does it have another name in another country? Instead of HIPAA, they call it something else?
Yeah, so Canada, I know, has a similar law that is very, very much like a HIPAA type thing in their healthcare system. It's a little easier in other countries because they have many of them have that single payer or type system. So managing data privacy and exchanges of information is a little easier. We're really the only country on earth that has health insurance companies at the center of our system. So making, HIPAA insurance portability, protecting and making sure that they're doing right by your data and things like that is really the main focus. But
Okay.
yeah, there are very much significant privacy laws, especially in Europe, Australia, Canada, that would definitely apply to healthcare
Yeah.
organizations.
I guess it makes sense because of the private sector here in the US,
Mhm.
where there's a lot of transfer of information, obviously. It will be different in Canada, where the transfer of information is mainly just with the government itself, because they're
Right.
the one funding the system. Um, so yeah, it makes sense. I never thought about it, but it makes sense that HIPAA is probably more important in the US compared to other countries because of that, because there's so many other people involved in any transaction sometime.
Yeah.
Yeah, it makes sense. So now let's go into what determines whether a medical device company is a cover entity, a business associate, or not subject to HIPAA at all. Um, the terms are not clear for me, so you can explain.
Yeah, so this is really where a lot of people get tripped up and confused as to what HIPAA actually means and if it applies to them. I've really run into two camps of folks. One is this applies to us, and if we don't do any and everything about HIPAA, the FBI is going to kick down our door and arrest us all. Or the people on the other side of the spectrum who are like, we don't do anything with healthcare information or anything with patients. So I don't know why HIPAA would apply to me. And it's a little more nuanced than that, right? So HIPAA applies to PHI. It doesn't necessarily apply to, people or individuals per se, if that makes sense. It's more of um, hey, this is, we are outlining how to protect your PHI, right? And so what a lot of people fail to realize is it's really centered around the maintaining, transmission, or creation of PHI. So if you are a device manufacturer, for example, and this is sort of an area, an example, if you will, of where people will get tripped up is if let's say you have a device that's a wearable wristwatch that monitors some sleep behavior, right? And you are working with a Humana at a big insurer, and they take that and they say, "Hey, you are going to go give this to all of our pediatric clients that we use for Humana, and then share that information with the doctor, and then move forward from there." That would be an example of, hey, you are transmitting and creating PHI, and may even be storing it, right? Because if you're that wearable device, you likely have a cloud system, or you're running some sort of AI agent on it to, I guess, uh, perfect your platform. But, that's an example of like, hey, this is true transmission, creation, and possibly even storing a PHI. And they, having worked with an insurer and having that direct relationship, they likely would be really a business associate, but really have strict HIPAA controls, because they would just be the business associate of the covered entity, which is Humana or the doctor, whomever. But they would have very significant controls.
Right.
But if you are a covered entity, you would likely have an MPI number, be billing insurance, or have been guided to, or I guess advised to be fully HIPAA compliant as if you were a covered entity. And there are examples that I would recommend that. For example, that, or I should say, the example I just gave of that wearable device, would highly recommend someone like that to treat their company as if it is a covered entity. And when you do get into sort of that technology side, HIT sort of kicks in as well, where you have all these other rules around your product and service. So that would probably be my best, summation of it. Is, you know, the OCR, Office of Civil Rights, the enforcer of HIPAA, uses this language often, which is reasonable and appropriate. If it's reasonable and appropriate, to be more compliant or whatever it is, or less, right? Just make sure you have a reason for it, right? Think about it and explain why, because you will get asked at some point being in this industry. And, if you are someone who decides to table it or ignore it, it will hurt you in the end.
Yeah. Well, I think it's better to be more compliant than less
Yes,
compliant at the end
yes,
of the
very much
day,
agree.
uh, to play safe. You keep mentioning PHI, and I don't think we define what it is.
Yes, I'm so sorry. Yeah.
Okay.
So PHI is personal health information, and there are 15, I believe, unique identifiers, from your name to social security number, even like a driver's license number, anything that can reasonably associate you with that information. And as I mentioned, there is a list of those identifiers, and I can share a link that you can put in the notes or whatever that people can
Yeah.
access. But it's pretty, obvious stuff: name, date of appointments, appointment times, your doctor, things like that, are all protected PHI.
Okay. Um, And one of the reasons that we came in contact with your organization is because us, as an importer of medical devices, as a distributor, as a company we invoice, hospital for medical devices, I was questioning, do we need to be fully HIPAA compliant, or what do we need to do exactly? And I'm pretty sure that there's a lot of people that never question that specifically, and I think the reason one of the reason we do those kind of podcasts is for people to make them aware that maybe they should look into it.
Mhm.
And I think that's probably a good example. You did give, a concrete example of medical device scenario where HIPAA compliance is required. So you were talking about, device that record information, um, and what's happening right now in the US is that obviously a lot of manufacturing companies try to go around the medical device definition of their product and stay on the wellness side because
Yep.
it's there's some compliance to do, but it's less restrictive. um, but I guess it doesn't really matter, if you're a wellness or you're a true medical device. You if you record information, personal information, you still have to be in a HIPAA compliant situation, right?
Yeah, and that's a very interesting example you bring up. A lot of that, in 2020, you had an explosion of like, I think the App Store saw 30,000 new wellness apps get launched, which is an insane number. Um, but I think really working around the medical device label is more of avoiding the FDA, if I were to guess.
Yeah.
Because for the
Yeah.
most part, if you're going to, label yourself as a, wellness or health and wellness instead of, hey, we're a true medical device. I've worked with organizations who have done that. Um, you will fall under FTC enforcement when it comes to personal health information. So the Federal Trade Commission actually has a data privacy rule and breach notification rule for these exact reasons. And so it really is just knowing what you need as an org and what, level of risk tolerance you have and saying, okay, can we lose a customer over this, or are we at a significant risk for a breach, right? That is like the number one and two things. Well, I should flip it and say risk for a breach is the number one thing, and then two, losing a
Yeah.
customer. But those should always be, top of mind and weighing that constantly. And I think the best way truly to get to that point is working with a company like Ironforge, right? Where you can get to a point where you can look at any covered entity and say, we have the controls and safeguards in place to engage in a business associates agreement, right? Because
Yeah.
business associates agreement is essentially the Coke Zero to the Coke of HIPAA, right? Where it's kind of the same thing, but it's not as, thick and, hard to drink, right? It's, a little smoother and you can digest it a little better. And, you know, there are many, companies and products out there that can help you get there. But
Hmm.
as I mentioned, what we would want to do in a place like Ironfort is for a medical device manufacturer or supplier, whatever it is, get to that point where someone brings up HIPAA. You just say the magic sentence, we have the proper controls and safeguards in place to engage in a business associates agreement. And then when you get into the vendor assessment process, their vendor assessment will be in I guess, the context of this is a business associate. And what we do at Ironfort is assure that, there's pretty basic questions that they ask on these, and we make sure you're in a position to answer yes on all of them. And if you have to answer no, be able to provide the document and evidence that, hey, we decided not to do this because ABC, or, yes, we do have a breach notification policy or HIPAA workforce training. And some orgs just take that for what it's worth and say, cool. Some say, hey, can you, show us, Mike Scheerhorn's HIPAA training from last year, right? That happens a lot. So just getting you in a position, and Ironfort would, be able to store that training, right? And we have that training history. So you're not, as a small organization or startup, having to look for, your co-founder's HIPAA training from 2023, right? Because you claim to have been HIPAA compliant, in a shared drive or OneDrive somewhere, right? It's all right there. And that's truly like the easiest way. I think these platform-based organizations like an Ironfort, and really what we focus on is the outcome, right? Like organizations, they don't, they like the products, they like, the interfaces and things like that. But at the end of the day, I want to get them to an outcome, right? And the true
Yeah.
outcome is compliance.
Yeah.
Now, what does HIPAA compliance actually mean? That's complicated, right? And that's sort of what we're getting, kind of trying to dig
Yeah.
into, but it is, getting you to a point where I would, put my hand on a Bible and swear, hey, you can say this to somebody. You are, in a position to engage in a business associate agreement, and you won't fail an assessment, and people won't have an issue,
Yeah.
with your controls and things like that.
So I will take an example, and I need to tell you to tell me if HIPAA applicability, would be applied, to that situation. So
Yeah.
there's a lot of situation where, for example, a vendor will sell, a medical device, manufactured by a company based in whatever, Switzerland, Germany, whatever.
Mhm.
And those, I would take implants, for example. So the rep there is the vendor is there during the procedure. and he takes notes, So he will take maybe the name of the patient or the initial, the dates, the hospital, the implant number, and etc. He bring that back information. He write that, in I don't know, a customer management system, and the manufacturing company also will have access to this. So obviously, the hospital is already HIPAA compliant, because
Mhm.
they have to. But what about the rest of us?
Yeah, so that's a very interesting scenario. So, when it comes to sort of when you take the provider out of it, right, it gets very complicated. So, HIPAA protects you and your provider's interaction is in sort of what your provider does with your info in reference to your insurance and disclosures to the government or law enforcement, right? So when you have someone in there who's, taking notes, right, and it's all handwritten, that's technically yes. I would say that, is PHI because you can link that to a patient. If that, notebook were to get stolen from them, that is, someone's info, right? And they know that they got a cochlear or whatever it is, right? But I think, in a situation like that, that's where an organization, it's really just an ethics question, right? I don't think that is necessarily ethically wrong or morally wrong, right? We're just 99% of the time, there's no nefarious intentions, especially in that scenario. I don't think,
Yeah,
Steve or whoever was in there is going to take that and say, I'm going to go harass this person on Facebook or whatever it is. It's, no, we're trying to make our product better to make people healthy, right? And I do think most people come from that perspective. And so if you're that organization and Steve or whoever brought that back, and that is, Susie's cochlear info and whatever it is, I would say it's reasonable and appropriate to put additional safeguards around, whatever CRM platform is going into, limit access into it. And especially when there's I would say a fourth and fifth potential party, right, that may have access to it. That just
yeah,
becomes more of a ethics question, right? And like I said, it's not necessarily nefarious, but it is like, hey, we should probably put some additional controls around this. But that's how I would approach it. But it's
okay.
always better to be safe and to be transparent, right? That's the number one thing, open and honest, telling that provider, hey, I'm taking these notes. Is it okay with you if we put them in our CRM platform or whatever it is always the way to go. And if honestly, most people will say, let me see, let me check. And usually a lot of the time it'll be a yes. And if it is a no, just honor that request. I think is the best way to look at that sort of scenario.
Interesting. So now, what if I'm looking at the most common assumptions the medical device company make that lead them to think that HIPAA doesn't apply when it actually might? What's the common assumption that those companies make right now? Do you think?
Yeah, I think the number one thing is hey, we don't interact with insurers or we don't interact directly with patients is the number one thing. Even if you're sort of like a conduit type product, not literally the company conduit, but a literal conduit type product that, hey, we're just sort of transmitting this info to this cloud platform or to this other device or this insurer, whatever it is, right? Um, the number one thing is, hey, we, don't interact with the patient directly. I would say is the number one thing. Or, hey, we don't store any of the info. Well, you create and transmit, and, there's a lot of, I guess, back and forth. And, you could put 10 HIPAA people in a room and say, give them the same scenario, and you'll get 8 and 9 sort of the same answers, but a little different, right? And that's what makes this so fun for me, right? Someone will watch this and go, this guy's completely wrong. He doesn't know what he's doing. And it's like, yeah, but, I could ask 4 or 5 other people the same question. But, I do think it is very hard to assess, and it's just better to be safe than sorry. I would see even a product like an Iron Fort, right? See it as an insurance policy, right? Of not losing a customer or, not having a data breach or, well, it doesn't necessarily stop you from having data breaches. Let me clarify, but, getting significant fines for a data breach, I should say.
Yeah.
And, whatever you value that at, that's really the question. Right. And like I said, I think getting your organization at least to a baseline point where you can say, yes, we're good to engage in a business associate agreement. You're pretty good shape, I would say.
Yeah. And it's interesting because obviously, I think HIPAA compliance and cybersecurity goes, hand to hand because,
Yep.
as a company, even us, we are exposed to hacker can get, into our system. That's why we do work with a cybersecurity company to make sure that we're covered. And I guess that's something that you need to show with the HIPAA compliance that you do have a cybersecurity in place to protect the information, right?
Yeah. And that's a very good point about the cyber side. So I would say 90% of organizations, if you have a customer, like if you're a medical device company or definitely a tech company and you have a customer, you probably have the basic security controls for HIPAA. So HIPAA is very broad, right? For example, the technical security control, one of them is automatic log off, right? And it literally says, do you have automatic log off?
Wow. Okay,
Yeah,
good
we
point.
have it, right? And so many people will already have many of these controls, but it's about having it written down, right? And documented, et cetera. HIPAA is very much a lesson in documentation. But where it gets a little different and tricky is the privacy and breach notification aspect. So most organizations will have SOC 1 and likely, well, most will have SOC 1 and likely SOC 2 as well. And SOC is I guess, SOC 1 is I guess, let's say, static assessment of your environments, your policies, procedures, very similar to HIPAA, right? And then SOC 2 is sort of that dynamic assessment where they assess you over time, there's testing, et cetera, and there's an auditor that comes in and validates it, right? If you've done SOC 1, you are probably 75% HIPAA compliant.
Okay.
And then all you would need to do is really address those privacy components. There's certain privacy components as well as breach components and, excuse me, as well as training. So training people on what a breach is and who to contact, things like that. Those are all things that, you would be able to address pretty quickly. So if you're SOC 1, you're in very good shape. But the security rule on the HIPAA side is very limited. So what they tried to do is make it very broad and allow organizations to be reasonable and appropriate, filling it in, right? So it's almost like a Mad Lib, right? If I'm not sure if you remember Mad Libs from when you were a kid, where it says insert a
Yeah.
verb, right? So it doesn't say, use, you need automatic log off, in this format or et cetera. It's not prescriptive, right? It's not saying this, do this. It's, hey, encrypt emails with PHI, right? And you could have, Donna who sits at the front desk and sends out the emails. If she sees PHI is in it, she clicks encrypt. If, you could have another scenario or another organization that, hey, we have this really fancy tool that goes in and searches and checks if there's PHI in it and will encrypt it if there is. And then person 3 is we just encrypt every email. Who's
Okay.
right? Right. And
Yeah.
so there's so many different ways to approach so many different components of the rule that that's how you kind of get these scenarios of, getting 10 compliance geeks like me in a room and getting, 7, 8 different answers is like, what is correct? Right. So it is, relatively broad and easy to address. It's just knowing, okay, what do we actually have to do? And like I
Yeah.
said, it's like Iron Forward, that's what we help with and just take it completely out of your hands.
Well, I think the way you're presenting this, because we have the same situation sometimes with custom broker. Or we could have 10 of them and they could
Yeah.
have all different answer to a specific question. Um, I guess at the end of the day is what you how can I say that is if you explain your decision why you
Mhm.
did or did not, it's probably what's very important, in to be HIPAA compliance. Uh, am I right?
Yes, that's very much on point. So HIPAA is all about documenting risks that are associated with the frameworks, right? So, hey, we don't, let's say, take email encryption, right? It's, do you encrypt emails with PHI? It's, I don't know, or we don't, or I didn't know we had to do that, right? So that could be, I'm sorry, there's some in the background here, but the number one thing is to get all those risks identified, right? And then working to remediate those risks. And so
Okay.
if you have a list of 50 risks that are associated with the frame of the HIPAA framework, right? You could really say not fix any of them, right? But if you have an explanation as to why and it's reasonable and appropriate, right? I'm saying that a lot, but that's really the number one thing. Um, yeah, that's the number one key component to the rule is making sure that you
Okay.
are documenting what you're doing and how you're fixing things.
So, what would be the documentation or agreement or control should buyer or hospital expect to see from a HIPAA relevant medical device company?
Yeah, another great question. So there's really no magic bullet, right? To saying, hey, if you hand them this, you're good. A lot of people will accept though a SOC report because, for example, HIPAA is a trust me, bro rule. It's hey, do you have this? Yes. Okay, cool. SOC is really one of those things where you have an independent auditor come in and give it a stamp of approval, right? So if you hand an organization a SOC report, you're in a very good spot, and most
Okay.
will accept that. But for the most part, they'll just uh, send you a vendor risk assessment, and if you say yes to something or no, and they say, hey, do you have documentation on that, right? That's where they get you. And that's what the documentation would need to be. And a lot of that is just policies. So just literally having a written policy about
Yeah.
mobile device management when, you on a vendor or security assessment, it's what sort of, how many assets are in your organization and how are they managed? And when I say assets, I mean, devices, things like that store information. And it's, well, we have cell phones and all this, right? It's okay. Do you have a mobile device policy for those people? Yes. Okay, cool. Right. And you just move on. But if they say, hey, can we see it? That's what they'll really ask for. Right.
So, if you are a company and you need to be, HIPAA compliant and put everything in place to be, um, do you have to train everyone in the company or only people who will deal with those personal information?
Yeah. No, good question. The answer is only the people that will interact with PHI. So if you're someone that has segmented your company into, let's say, retail and life sciences and whatever, your retail folks, if they're not interacting with PHI, you don't have to train them on it. But
Okay.
if you have life science account managers, right, that are transmitting PHI or interacting with covered entities, they would have to be trained, and that's what that sort of question would appear in a vendor assessment from sort of that downstream entity, right? Is hey, the people who are going to be working on my I guess environment or with me, are they trained on HIPAA? Yes,
Okay.
right. So that there's cost savings there as well from not having to train every single person. So if you've segmented your company in that way, and you can answer an assessment that says yes, only the people that have been trained will interact with your PHI. That would be more than okay.
Um, One of the last question: what are the biggest red flags that suggest that the company does not actually understand its HIPAA obligation?
Yeah, the number one thing for me is someone saying, "Hey, we're HIPAA compliant," which is a very common phrase, right? To HIPAA nerds like me, it's no, that's not a real thing, right? Because it's a constant, ongoing thing, and you might not know it, but right now, Sam McNall, the co-founder of Iron Fork, could walk away from his computer, and some guy could snatch it or put a USB in it. Guess what? You're no longer HIPAA compliant, right? But the number one thing that would be the red flag is really if they don't know what a business associate agreement is, or they say, well, what do you mean a risk assessment? Or, yeah, I don't think I know what a business associate agreement is. That would be very much a red flag. Because if they're a HIPAA covered entity and they've never heard of that.
Yeah.
That would be a big one. I will say though, if you're working with a relatively large company, right? Let's say you're interacting with an Advent Health or Kaiser, big dog, right? And you're working with an account manager, they could be young, right? And not know. But
Yeah.
if you're working with a founder or, head of sales, whatever it might be, head of whatever, they should be well aware of what a BAA, business associate agreement, what risk assessments, what vendor risk, and things like relatively high level terms mean and how they address those. And if they don't, that would be a significant red flag. And I've definitely come across it many times.
um, HIPAA. Who control HIPAA? It's under which agency?
Yeah, so it's under Health and Human Services, and the enforcement sub agency is the Office of Civil Rights, which people are like, "Wow, the civil rights is deals with my health info," but like I mentioned earlier, it is very much a consumer protection rule, and so they have the FBI would, if you're someone who is stealing, patients' records and selling them to Russia out the back door, right? The FBI will be at your door because it is DOJ enforced. So
Okay.
be careful, but don't worry. It is very hard to get to that point where, Cash Patel is showing up at your facility or your company. You would have to be doing some very egregious, terrible things with people's data. But yeah, they're very much a government agency, enforcement agency. And the FBI will be there, and you would face federal criminal charges in front of the Department of Justice.
So I think at the end of the day, if you're not sure where you fit in the HIPAA compliance, that's probably the first thing you should do is to contact, Iron Fort Solution and
Mhm.
and start working with you guys. So at least
Yeah.
evaluate, where you fit, exactly in that spectrum of
Yeah.
compliance.
No, and I would say
I-
the first thing someone could do right now after listening to this, if you're a founder, and just literally type into ChatGPT Cloud, hey, um, what is required for me to engage in a business associate agreement with a covered entity? My company does A, B, C, D, E, F, G. Doesn't even have to be that detailed. You could say we make cochlear
okay,
implants, right?
okay,
Type
yeah,
that
yeah,
in and just see what it says. And those are, you don't even, well, I'm not going to say you don't even have to. Definitely come and consult
yeah,
Iron Fort, because we do have the ability, and we have policies that we can implement right away, right? That address those gaps that you likely have, which are in that privacy and breach notification side. And there may be some security policies as well. So we do have like the non-technical policies like written out, ready to go for you. But that's the first thing I would do. And then just kind of ask your IT guy, right? Or your co-founder, whoever it is, and say, what are these things? Do we have them? Right. And they would probably be able to go into a little more
yeah.
depth on that. But, if you are type that in and they, gives you a list of like 8, 10, 12, 15 things, and you're going, never heard of that. Don't know what that is. Don't have that. Don't have that. Oh crap. I meant to do that last week. Right. Those are things that, you can do right away to figure out, okay, am I in a good spot? Right. And,
Yeah.
truly understand, hey, it's not that much effort to get to that point, but it definitely pays off in the end.
Nice. We will put, your contact information in the podcast so people will have access to it. Last word.
No, thank you so much for having me. This is a lot of fun, and it's been great working with you, both, from an Iron Fort perspective, as well as, doing this podcast. Really enjoyed talking HIPAA, and, this is fun for me, and hopefully someone learns something. That's just kind of my goal, to chip away at HIPAA. And, I want people to really understand it and to appreciate it. It is very much a lesson in philosophy, right? And it's not linear thinking. It's very abstract, and
Yeah.
it's just so interesting to me. And I just hope one day someone else will just appreciate it as much as I do. But thank you so much for having me, and I've really enjoyed it.
Well, I think you made it more sexy. So I think that's
Yeah, hey, I tried
under a
to.
positive note.
Yeah, I comb my hair and trim the beard up. So that's what I was going for. So good call on that one.
Well, it's about passion. I think it's
Yeah,
everything that
no,
we
it
do.
really is passion time, and
If you put
it's
passion into it, it sounds always more sexy at the
yeah,
end of the
right.
day.
And it's, people think I'm crazy and weird, but I'm like, I love it, man. I think it's so interesting. And a lot of that interest comes from how many people really fundamentally struggle to understand it. Because
Yeah,
it's very much a rule where, in the West and the way we're educated in the West is, hey, you have a problem. There's a one objectively true answer, right? So in the West, that's how we think.
Yeah.
In places like China, they don't think linearly like that. It's more abstract and that sort of thing. So, someone from China would kind of understand HIPAA and how it applies and works better than an American because, when you're talking HIPAA, it's what do I need to do? I want to be HIPAA compliant. I know there's a silver bullet, right? And that's just how we
Yeah.
think. And so
Yeah.
it's very much a lesson in, so many different components of life and, how we're raised in the West and compared to our peers and why Americans really struggle with HIPAA. You
Yeah.
could be a person who, this is strictly an example, you go and do an armed robbery on a gas station and you can ask a lawyer, hey, I committed an armed robbery at a gas station in Florida. What happens? Right. And they can give you a pretty good idea as to the fines, terms, length of sentence, things like that. You have a lawyer ask, hey, what happens if you don't encrypt an email with PHI? They want an answer like you get $1,000 fine, right?
Yeah.
So that is something they would understand, but it's like, what do you mean if you don't encrypt an email? Yeah, what happens? Like, what happens?
Yeah.
You better hope someone doesn't, intercept it or breach your, network or whatever it is through it. And they just don't, they very much struggle in, putting a price tag on the risk, right?
Yeah.
And saying being, HIPAA compliant or whatever costs this much. But,
Yeah.
it's a very fun industry and I've always enjoyed it and look forward to continuing my career in it with Ironfort.
Perfect. Well, thank you very much again for your time. And
Thank you.
I hope people will enjoy this podcast. And I'm sure we're going to have questions. So I'm probably going to forward that to you. So thank you
Please.
again.
No, thank you. This is great.
Thanks.